So thanks everyone. Welcome to the Water Program Team Seminar of a webinar for the University of California Division of Agriculture and Natural Resources, the Water Program Team. My name is Samuel Sandoval. Mi nombre es Samuel Sandoval, Professor Extension Specialist at UC Davis, Faculty Associate at the California Institute for Water Resources. And I really would love to present a lot of our preliminary findings and results that we have on this project. The name is Rapid Baseline Assessment for the Wastewater Needs Assessment. So welcome everyone, bienvenidos. And what we are going to do is, so this is a lot of pictures. And what I'm going to be doing is showing you a little bit of those. So the wastewater needs assessment is within a larger project. So, excuse me, the survey baseline is within the wastewater needs assessment. So this project that you're seeing here in this lower left corner is the larger project. The main idea of this project is to estimate what is the gap of people not having adequate wastewater services, adequate water sanitation throughout the state. The team is composed by UCLA, UCANR, and then Sac State and University of Massachusetts. And each of these institutions are doing something different within the state. Basically, in our case, what we did for this project was to estimate to do a rapid assessment. So what are the project, what are the problems, what are the barriers, what are some potential solutions and definitions for wastewater in the state. So that will be the explanation for the largest project. In our case, what we did was, so the objective of our small project was to gather information on water-related sanitation needs with a focus on household and communities, and in order to inform a baseline assessment. So we were the first team going out, trying to identify what are the needs, what are the issues, what are the conditions of wastewater throughout the state. So this project has specifically three different parts. The first part was to do a survey, administer a survey in order to understand some of these wastewater needs at the community level. We did it with experts and community leaders. So we didn't ask community members, we went with people working with communities. We did a spatial analysis, and currently we're doing a field campaign. And the field campaign is to collect the stories from the survey, the results that we have from the survey, document on the ground what are the conditions of the wastewater needs, and also validate this survey. So it has those kind of specific objectives. Now, in terms of our methodology, so basically of these three parts, the methodology is as follows. So for the survey, we want to estimate what problems exist, how frequently they occur, and in which type of communities, in order to identify patterns, magnitude, and frequent issues. We did a structure survey, and this is a quantitative approach and descriptive among different sectors. Basically, we administer this to academic, extension specialists, NGOs, technical assistance providers, governmental officials, the private sector, journalists, and we collected 112 responses. It was a snowball sampling, so letting us know if someone else knew about this. We did it in Qualtrics. And the output is a report, some tables, graphs, and patterns. And later, Erica will be sharing the fact sheet and the report that we have for the project. This part of the survey has already been finished. We submitted a report, and now that one is already publicly available. The spatial analysis, we also already do it. We wanted to estimate where are these problems concentrated and what factors exacerbate these problems. We did a GIS mapping of mobile home parks, disadvantaged communities, tribal lands, farm housing, and other things. And basically, these we're trying to put together a database that will be publicly available. The field campaign, that is what we are doing right now. We want to identify, to document why those problems occur, how they are experienced by the community members, and what are some of the potential solutions. We want to bring stories to the data, document sanitation issues through pictures and quotes, and validate the survey. And what you're going to be seeing us doing is interviews and focus groups. We do a semi-structured interview. We actually have a rubric where we can validate our survey results. And this is sometimes with community members, community leaders, operators, residents, technical assistance providers, and so on. Where we have recorded interviews, field notes, and observations. So now this is basically what we're doing. What you saw here, this is actually what is under the hood. This is what we are doing. So I'm gonna start presenting some of the results, and the results are as follows. So in terms of the definition of water sanitation and water sanitation equity, water sanitation is access to safe, functional, affordable, and dignified collection and disposal of wastewater from human uses, and those can be domestic and industrial, including adequate sanitation systems, practices, wastewater treatment to protect the public health and the environment. We came together with this specific concept. You will be surprised, but it took us a lot of time. And in terms of water sanitation equity, what we come up with the definition is achieved when social, geographic, economic, cultural, and demographic attributes no longer predict people access to or quality of water-related sanitation. So basically, when there is nothing on this can be associated with access to water sanitation. Now, this is the summary. What you're seeing, these red points, is some of the locations that were mentioned in the survey. All the different blue points are the places where we have done visits and when we have collected data doing the field campaign. We have visited more than 40 locations, and we have talked with over 100 people. And this is still ongoing. We're going the North Coast and the Central Coast soon. So let me talk about some preliminary results. I think before actually talking about the results, I want to show you the people. This is the faces of so many people that we have talked throughout our visits and more, where they have been locally sharing their expertise with us. In terms of the first, so these are some of the key results that we obtained from the survey. And basically most respondents, about 80%, noted that water-related sanitation issues are over 10 years or longer. So people have been experiencing issues with water sanitation, with lack of sewage or problem with their sewage or septic systems for 10 years or more. This is a quote from one of the people that we interviewed. Many residents are paying for the sewer and it doesn't come. It doesn't come. The sewer, it's coming at turtle speed. Muchos residentes están pagando y el drenaje no llega, viene en tortuga. So basically, from all the communities that we have visited, those 40 that we mentioned, 40 have mentioned that they've been experiencing sanitation issues 10 years or longer. And let me see here if I take out this. So this is one of the communities that is experiencing, and I mean, this community has been experiencing lack of access to sewer. They rely on septics for more than 10 years. They even mentioned that the public park is already being built, and the sewer system is not coming. This has happened. So the public park was not in the process of being built, and now it was planned, get the funding, and built before the sewer. Okay, let me go to the next one. Okay, housing types. So most of the water-related sanitations occur in family residences. So 44% in family residences. Some of them are single, some of them are multifamily like this one. RVs, RV parks, and mobile home parks. So basically one of the quotes from the people is, they say, we need help, but we don't have access to the funds. And having access take many years, and meanwhile, the people are struggling. And we have heard this so many times. Basically, people that are experiencing water sanitation issues, they are in this dilemma to invest and improve it, or wait for the consolidation. And basically that these funds take many years. And meanwhile, while people are waiting, people are struggling quite a lot. Socio-demographic factors. Respondents indicated that these cross ethnicities, non-Hispanic white 34%, Latino 28%, and mixed 18%. We have seen all over. So some of the questions is like, you figure out 2 answers, but then you have six more questions. So it is difficult. Based on these pictures, you cannot identify which one is. For instance, this will be a Latino neighbor. For instance, this will be a white non-Hispanic neighbor. For instance, this will be a mostly Black community. So you cannot see by looking at the houses what is the community behind. But what we have seen is that mostly is in disadvantaged communities, in low income, which is following to this one, which basically most of the respondents mentioned that water-related sanitation issues primarily occur in communities that meet statewide criteria as disadvantaged. Again, these are a disadvantaged community in the Sierras, a disadvantaged community in the Central Valley, a disadvantaged community in Southern California, and a lot of small communities needs to step up. They want change, but they want to be the change of agents. And in this case, this quote comes basically saying that a lot of these communities want something to be improved, but the community members need to invest the time. And we are asking these communities that they are struggling with money to take a second job and try to advocate for their houses. And for me, it was kind of a very difficult part to do for the community members. In addition to being able to do this for more than 10 years, as we're seeing that a lot of these problems persist 10 years or longer. Now this, one of the most common sanitation issues is related with septic systems. No or intermittent water supply at home for water-related sanitation and reliance on mobile toilets. So basically what you're seeing here is some community members. In front of here is actually the septic entrance, but it is covered by a ground. And basically, she's the person, the owner of this. It is actually a church. And basically, she figured out that she had issues with their septic system when the septic was backflowing. And basically, that's when she didn't know where the septic tank was, so they have to look in their backyard. Also, for instance, this quote comes from the owner of this house. I bought a house and later realized that I was on a septic tank system. So basically, people are selling their houses, not telling others that they are on septics. There are entire communities of 2,000 houses, 3,000 houses, where they are relying on wells and also on domestic wells, and also on septic systems, each of the houses. So one of the common issues are related with septic systems, no or intermittent supply at home, and reliance on toilets. And one of the common was that you can spot tanks in summer because that's where the grass is green. Here, what you're seeing is actually, this is a mobile home park. You can see two mobile houses, and in between there is a septic system that has failed. So this is a septic tank failed. They are trying to clean it. And what you're gonna see on this picture, on this movie, is how a septic system is cleaned by a community member, by a woman. So there she is, she recorded herself. So she is now uncovering the septic, and you can see that the land is heavy because basically it's full of the wastewater is saturated. Yeah, she's uncovering it. Good thing that she has gloves. She doesn't have long pants. And there you go. She's opening the septic tank. And then everything is coming out. You're going to see that she will start stepping back. Yep, because everything is coming out. This will be how it looks, a picture from the top of what she was uncovering. And this is nothing that we have not seen. This is not uncommon. This is how septic tanks get full, and then people realize that they have to empty it. Lacking that every year that they empty their septic tanks is pretty common. So you can see backflows. Here, this will be a backflow in a shower, some backflows under the sink, in the sink. So lack of septic maintenance is the most frequent reported issue on septic systems. And basically, this is a person that we visited their house, where she says, my insurance will not cover another backup flow incident. So she has been claiming some of these to her insurance. Lack of water access. So no or intermittent water supply means that you don't have water sanitation. These are three different examples. Once we get the water and sewer, people will clean their houses and properties, and it will become a good neighbor. This is a person that we talk in Southern California, actually close where you live, Ali, in El Centro. And basically there are houses where they are supplied only with what they call canal water, water from the irrigation district, even though the houses in front, right in front of their street, they do have drinking water. But on the other side of the street where he lives, they doesn't have drinking water, and this is a septic system that a septic tank that has failed, that is just broken. For instance, in this community, because they sometimes PG&E shut off during the summer season, when there is a peak on the energy, they cut this community of electricity. Thus, the drinking water is not available. Thus, they don't have sewer systems. They don't have wastewater treatment plants. And in this case, well, they just don't have any water at all. Thus, they don't have access to sewer. Mismanagement. Few respondents know of locations where raw sewage is spilling into water bodies or land. When reported, this occur at private families. This is the discharge somewhere. This is the discharge of a wastewater treatment plant somewhere in Northern California, in the Sierras. So you can see that literally when there is excess of wastewater, it is discharged raw into the rivers. The same in some lakes also in the Northern Sierras. Some of my neighbors discharge their shower water into the garden. This house, basically, you can see that it doesn't have any pipes under the mobile home house. And that is because basically they don't have drinking water, and whenever they bring their tanks, water in their trucks, all the sewage is just coming into the field. This is a treatment plant that when it rains, it will have all the water coming, all the runoff on top of the land to these evaporation ponds. And on this side is the river. So water will also be discharged into the river. No indoor sanitation plumbing. Respondents indicated that issues is experienced primarily in communities facing homelessness and housing insecurity. We have seen the on-house population increasing in the last 5 years. So this is an on-house encampment. They are just coming and starting their own community. This is when people have been abused for so many years of the mobile home parks. Sometimes they decide to get together, buy a property, and bring all their mobile home houses here. It's unregulated. All of them these are families, and they start getting together without adequate either drinking or sanitation infrastructure. And this is just basically one of those that, yeah, you cannot do anything with the house because it doesn't have nor services nor adequate indoor sanitation. Yeah, this is Southern California, Central Valley. Environmental and public health. Residents are showing illnesses, symptoms of malfunctioning septic systems, mobile home toilets, and when indoor systems are not usable or not functioning. This RV, here the septic tank has been filled, and they are about to open it and discharge. There is a tank, a septic tank, that it will come and take out all the septic content here. A lot of these are just malfunctioning. This is somewhere in the Central Valley where when you have big floods, the floods can inundate the entire city, and the septic sewer can backflow into houses. So anyway, there is a lot of public health issues related with the sewer systems. This is a community that is living just 40 feet away from the evaporation septic ponds. So now I'm going to talk about, so these are the main, the key results from our survey. And this is how the field campaign is informing some insights, trends, and patterns that now we're seeing statewide. So these are some of those insights that we're seeing statewide. Let's go here. We're gonna talk about this septic to sewer and some trends and issues related with septic to sewer, something that we call wastewater islands. And let me talk about this as we go. So these septic to sewer, some of them are called wastewater islands, or also we call it hidden in plain sight. These are places that can be within a city or in the periphery of the cities that actually don't have, that are not connected to the sewer system. They are on septic. So you can be in the middle of Fresno and there are communities that are not connected to the sewer. What this means is that you will not be able to see it unless people start raising their hands and seeing all these problems. And it comes with a lot of issues in terms of fairness and equality. So why all of these communities that are surrounded by the city were not connected to the sewer system? You will not be able to identify. So this is, again, this is Central Valley. These are Southern California. And you can drive through them and you will not be able to see that you cannot identify which communities are on septic or not connected to the sewer and so on. What you're gonna see here in this is that right there where these cars are passing is where there is the sewer line, and all these houses All this
Like
neighborhood
maybe they have like
is on septic.
the information that they have septic.
So you can be driving through different parts of the state and you will not be able to know which one is on septic and which one is not. So let me go back. Wait. Here. Okay. So when we say these septic to sewers and specifically from the wastewater islands, they are hidden in plain sight. There are many different neighborhoods that they have been on these specific in these locations where we just cannot see where they are. If we look at this, yeah, this is how they look. I mean, you will not be, we just pass from the on-sewer, no, from the sewer to the on-sewer portion of the neighborhood. Projects with years and nothing happens, in some cases 20 years. There are no clear rules on when to abandon the septics and when not to abandon the septics. One thing here that I want to not show you is this. So this specific, okay, there. So this specific neighbor, all the lines that you're seeing here is sewer lines already built in it. But only this red area and this red area already have, is connected to the sewer system. The rest is on septics. And it is on septics even though it already has the sewer pipelines. They just have not been able, the city has not accepted to connect these folks to the sewer system. The other communities that are septic to sewers that we call not close enough. And basically in these communities, what you're seeing is that the cities in this area and this, we have these specific satellite communities. And because they were not close enough to the city or the city limits, they have been relying on septics. Also, you can think that having the question marks of not close enough, because sometimes the city lines, the city limits have been drawn just around certain areas, in this case, these red areas. For instance, in here, so think of this, like the city line is this one, and these three red areas are outside of the city, so the city cannot provide them the sewer. So yeah, we have seen a lot of legacy of redlining and racism practices is still being affecting the communities that live in the Central Valley. This is the same. This is another community that it is not close enough. And basically the community member says our water bill is more expensive than in Beverly Hills, which it was actually true. What these folks were paying on this community was about $220 to $250 per month on their water and sewer bill. You can see that some of them here, they are relying on mobile toilets. So this is the communities, this is how they look. The technical assistance providers are leading the charge, self-help enterprise, RCAC and others, helping them to build projects septic to sewers. The people lost trust in the community leaders because it takes a lot of time to get consolidated. You need a lot of community leaders because the projects will take a lot of time. We have seen business and industry. We have seen Amazon warehouses or chains, restaurant chains, that the city brings them the sewer and drinking water. And 1 block away, we have seen the communities without access to water or the sewer system. And the recipe for success that we have seen is that there has to be a good mix of community leaders, approachable engineers, and technical assistance provider to go all the way to do these septic to sewer projects. Then we have the standalone communities that are really far away from other communities, and they have to rely on or build their own sewer systems, small treatment plants. These are in the Salton Sea, in the Central Valley, high in the Sierras. Some of the communities are really small and they are very far away of other wastewater treatment plants, so they cannot consolidate. Some of these communities are self-formed because of the lack of affordable housing, what I was mentioning. These small neighborhoods, colonies of people that they get away, that they try to evade the predatory practices of mobile home park owners, or a on-house community creating their small community. And then now they don't have access to all these basic water and sewer systems. Some of the solution is small wastewater treatment plants or replacement of septics, even though this is right now taken out of the table from the state. Now, in terms of wastewater treatment plants, we have seen our fair share. These holes that you're seeing in the pipes is basically that the pipe is missing a pump, and the pumps have been used in other parts so they can keep the system flowing. You can actually see here, for instance, a flexible pipe that actually they are bypassing this system because now it doesn't have the adequate pumps to move water. These are aeration, evaporation ponds, treatment ponds, that some of them, they require aeration systems, pumping stations to move sewer from one place to the other. They typically get clogged by the not flushable wipes that some of the companies sell as flushable wipes. This is a vintage Ninhoff treatment plant. This is the treatment plant for a community. This is how it looks inside. So this is just a couple of barriers to the tent to collect the solid wastewater. On the other side, on this small door is what it looks here. This is all the collection of the fluids, of the liquids. And basically that is it. That is the treatment plant of a community. It is this tiny house separating it. We have seen, so this is a vintage that is working. We have seen another vintage plant that now you can see is not working. We have seen ponds that they are actually not working. They are not moving wastewater, not treating wastewater. We have seen dogs dead along these ponds. Again, vintage wastewater treatment plants. We have seen plants that they don't have this auger. So this auger, basically, it automatically cleans the screens. You will not be able to see here, but there is a trouser trapped in the screen. I think actually, so here, this is the trouser. This is what I was telling you of this plant. And you can see how it looks. So this is the inflow. You can see here, these screens have to be manually cleaned. And now these are going into the evaporation treatment ponds that are behind. This will be an upgraded plant. This is the outflow. You can see here now how what they have in here can be treated, regulated, more modern. This is somewhere in the Sierra. This is somewhere in Southern California. So in terms of treatment plants, aging infrastructure, all the treatment plants are more than 50 years and older. All of them need funding for operation, replacement, and maintenance. There is something called I&I, that is called infiltration and inflow. And what that means that the pipes are so old that they have cracks, and groundwater gets through the cracks into the sewer system. So they have now to manage more water of what they were designed. All pipes are broken. If the town that you live is 50 years and older, all the downtown has aging pipes. A small investment on current plants can get us far away. Yeah, a lot of these are just run with literally duct tape and wire. Think about redundancy when you're building a a wastewater treatment plant, you need to think of 1.5 wastewater treatment plant. You want to have spare parts. This is super important. All of them are redundancy for electric power. Basically, a lot of these, they will fail during power outages. So you need to have diesel, gasoline generators. In some cases in the Sierra, you need warm rooms. Otherwise, the chemicals will be frozen. All of them, they need these trash screens and the augers that I mentioned before. Otherwise, you're going to have one person just cleaning. Their job will be cleaning those screens. All of them struggle to collect funds. And there are good examples of wastewater treatment plants like this one that I show. Mobile home parks, basically these have been a trap for many. In theory, they are affordable. The reality is that you're living in some places that are not adequate sanitation. These are some of the evaporation infiltration ponds that are just 20, 30 feet away from the houses, living in direct exposure with their sewer. Yeah, you can just see so they should be 3 evaporation infiltration ponds right next to the community. You don't have, this is one of the comments of a person that we interviewed. You don't have to travel abroad to see third world living conditions in California. Mobile home parks, still the same. A lot of issues related with all the sewer. So some of the challenges, these vulnerable communities lack affordable housing. They are either directly exposed to illnesses. Most of them are Latino farm workers. And there is a lack of portable water and sewer in these communities. Mobile home park owners do not comply with county regulations. We have seen that. There is a lack of education. People throw all kinds of things in their toilets. All of them need trash screens. All of them struggle to maintain their systems. We have seen good examples where people have actually turned around their mobile home parks, buy them, and then turn it around. There are examples of mobile home parks like Polanco parks that follow county regulations. And actually they have gardens. So people can live well on this. You just need to be well regulated. And the last one, because I'm seeing Ali watching at me, is housing affordability. This is, I think, the largest issue, how to have housing affordability, because when these communities, in theory, they are house affordable, but they don't have actually the services. So communities lack access to house affordability. There are a lot of predatory practices of mobile home park companies. The historic racist redlining and just racism practices affect disadvantaged communities. These communities that I call not so close, basically is historic racist practices of having farm workers. At that moment, they were Black, and not living in the cities or not being within the city lines of white communities. So that was in the 30s, 20s, 30s, 40s, still persistent. Dual standards, so cities provide water and sewage to companies, but they do not extend these services to communities. Proposition 218 impedes cities to use funds in newly incorporated residential areas. If you will be, there is no city in the United States that could have expanded with Proposition 218. And right now we have barriers to actually use funds from those cities to expand into other. I think this is really bad. An increased number of unhoused population. This is, we visited a non-house shelter, and this is how it looks. They can have access to toilets. They can have access to washing machines. In some cases, I really encourage everyone to go to Woodland. This is how they are creating these tiny homes for the on-house population, that they have inside access to adequate bathrooms, clothing, washing their clothes, and cooking. So with that, I will finish our presentation. I would like also to thank, I know that Eric and Erika is here. If you want to download the report, you can use this QR. Also associated with this, I really want to tag along or to mention the California Water Course in order to make sure that communities can advocate for themselves. So this is a course that is self-guided and self-interest for water professionals and water advocates. So I will stop right there, Ali.
Thank you. Thank you, Sam, for your insightful presentation. I think we have time to open it to question.
And I'm not sure if it is question, because I can see here Eric and Erika. I'm not sure if they have any other comment, something that I missed.
Please.
Erika?
No, Sam, you were great. You explained everything. It's been really challenging to get all the ideas and all the information, but no, you were great. Thank you, Sam.
Eric, are you there? I think he's just a thumbs up. He might be somewhere. Yeah.
Yep, nothing to add. Thanks.
Thank you, Eric.
We have time for question, a couple of questions.
And I've seen some people here that have also joined us on the field trips.
Oh, good.
Yes, Hope.
All the team are here.
Camilo. I'm not sure. I'm seeing here Julie Ekstrom from DWR. I'm not sure if you have any comments, questions. Rachel, Christine Dobbin.
So Sam, I have a question for you. You know, so you work with several regions, areas so far. Do you have any comparison, you know, about the level of issues or the investment needs for, you know, some different regions or areas more than the other, or you see the similar issue in the region? Yeah.
So Ali, that is the question that we want to get. So how much will it cost to connect all these communities? I mean, everyone is different. Basically, right now, the people in the larger projects, they want to estimate the cost. So one is to identify where we have in the issues. It's not that easy to identify where we have septic systems and failing systems. Well, the failing systems, yes, because they have citations. And then identify right now, the authority, the State Water Resources Control Board, mostly they want to do septic to sewers. I think that's okay. It is very expensive. It is very expensive. They are taking out of the table replacing septic systems. And I think right now that is the question to how much will it cost? I was trying to go all the way back to our map, but basically it will be very expensive.
How about the level of issues? You know, you see any differences between the different regions in the state, you know, based on what you did so
Eric,
far?
go ahead.
Yeah, just to add context to that, in the US, you know, some states like California have tried to get a handle on where there are gaps in drinking water. And there's been some preliminary national level analysis using census statistics, Holly, to kind of understand where gaps in sanitation access exist, but no state has done this comprehensive of an analysis. And so our colleagues on the Wastewater Needs Assessment, UCLA's Luskin Center with Greg Pierce and Office Water Programs with Maureen Kerner, they're trying to, right now we're basically assembling all the bottom-up data sources. So going into all the wastewater permits to figure out where, you know, where there is permitted, you know, service for collection systems and treatment systems, but there's no central source to know where people sit on septic systems. And there's a real, like, there's a tension of a question as to whether the state or local governments have a responsibility to replace, provide adequate sanitation on sites with septic systems, right? It's not traditionally what we've guaranteed. It's because it's private property, a little bit different than the drinking water side. But it all goes back to sort of the human right to water and sanitation that was passed several years ago in tandem. So yes, there's going to be differences across areas for places that maybe rely more on private septics. And there's our colleagues on the project, University of Massachusetts, are also developing sort of a machine learning approach to be able to predict where you have sewer versus non-sewered access. And essentially, other than kind of the islands that Sam and Erica, they sort of visited and were talking about, if you've got collection system access, you're much more likely to, be provided with adequate treatment of wastewater. But there's kind of like a sliding risk scale that's smaller. You're more likely to be at risk if you're smaller versus a larger, medium or larger size system. But the end result will be kind of maps showing geographic differentiation in a couple of years.
Ellen, I'm also seeing that you were about to unmute. Do you have any comment, question?
Oh, yeah, I just wanted to, ask a general question about conducting a needs assessment like this. I mean, this is awesome and really cool takeaways kind of independently of that. But I was also just curious if you had any advice from conducting kind of a large scale needs assessment like this in terms of if anybody else like myself wanted to do something on a different topic, but of a similar style needs assessment, if you had advice for doing that based on how things went for you guys on this go around.
I think so. It was more, we did a little bit more intuitive, but so this one definitely in the survey, we did it in a way that we didn't want to go all the way to the community members because it was a baseline. We went to people working with communities. And in that case, one person can work with many different communities, but in that case, we ask if the people live there or if they work and for how long has worked. And that one allows 75% of the respondents were either working or have a professional, personal relationship with the communities. So that gives us what we talk firsthand, actually go without going to the community members. So that was kind of one thing here, the snowball effect. And so this was good. The other part is that something that Erica did is start mapping. As we were receiving the results, we know that it was disadvantaged communities, mobile home parks, RVs, tribal lands. And so start putting a lot of those in the map and see how your responses line with that. And for the field campaign, basically what we did is do not parachute on communities. Basically what we did is every time that we were going to a community, we contacted someone that has been working with those communities that can introduce us and then be project partners for that field trip. RCAC, Self-Help Enterprise, we have the State Water Resources Control Board, we have other institutions. So that was key on this one. And the other one is that it takes a lot of time. Like these field campaigns easily, now we've been in the 1 month, at least 20 days out in the, so those experiences. Is that good, Helen?
Yeah,
Helen?
thank you. Thanks.
I'm seeing here a question on the chat of Julie Ekstrom. Have you checked to see how much info you can pull from real estate sites? Zillow usually shows whether the home is. No, I think we haven't thought about Zillow.
Yeah, Sam, we did check that out. Or at least in the land, the tax assessor derived data sets like Land Vision and others. The State Water Board has access to Land Vision, and it's not consistent. So it just depends on the local reporting that's at the county level. So you're right that sometimes you will see whether it's sewered or unsewered, but it gets really spotty once you get outside of like major metropolitan areas. So I had to kind of move to the machine learning approach. And UMass, this group, Emily Gumpel, who was at UC Berkeley, they've done this in other states too, but not at the scale of California before.
Yeah,
Okay.
thank you.
Thanks. It might be worth looking at Zillow again because it looks pretty consistent that it has that under its utilities section and that you could scrape it out of Zillow.
Mhm.
It usually puts the sewer, is it
Okay,
called it
yeah.
sewer type?
Well,
One other thing, Julie, that I mean, people, well, not people, that in the project we have done. So while the State Water Resources Control Board required their sewer system GIS files for a long time, they're actually now requesting it or making it a deadline for this December. So you might be surprised, but they didn't have, before December 2025, we didn't have a statewide map for knowing where we have sewer systems in the state. We have it parsed out, but now they are trying to collect it. And basically it's this kind of, so if you have housing establishment and it is outside of these sewer systems, then it should be septics. Anyway, right now updating that.
Well, thanks for your really clear presentation.
Mm.
This is awful, but glad you're working on it.
Julie, we're thinking like really back of the envelope, 1.6, 1.5, 1.4 million Californians without access to adequate sewer. So it can be that is malfunctioning, that is at risk of malfunctioning, that they are not connected, that they actually do not have drinking water nor sewage, or that they have drinking water but not sewage. It's, yeah, eye-opening.
Yeah. You did a lot of travels, Sam, right, with your team?
Correct.
I see your blue points.
Yeah, all the way to your
points.
area, my friend. Like we went right there. Anyway, with some community members there. On that area specifically, Ali, I think they even the city is really against to include this area, and basically they send a couple of times the police cars. We have on your area, my friend, in El Centro, we had the police on our backs just when we were looking at some of these places.
Yeah, I can imagine. Okay.
And,
Is there any question?
well, just to comment that we're still traveling. We have the north and the central coast, right, Sam? Like if any of you know places that we should visit, just let us know, please. We will be happy to go and check it out.
And also, Ali, so associated with that, so the survey is already done. We haven't done the summary of the field campaign. We are now seeing specific trends, like what we mentioned about the wastewater islands, not so close, the mobile home parks, the on-house, the lack of housing affordability, that are kind of across different, definitely any low income. I think what we have seen very clear also is the low income communities, and those are really affected. And we didn't know how big was this. So anyway, if anyone wants to tag along, next stop is Northern California.
Thank you, Sam.
The next one will be here.
I appreciate your presentation. That was great. And the work you did. And thank you all for joining us today. We look forward to seeing you all again at the next webinar, which will be December 1st. It will be a Monday. Thank you. Thank you, Sam, and everyone. Have a good day.
Thank
Thanks,
you.
Ali.
You too. Bye-bye.
See you. Ciao, ciao.